My name is Chelsey Caruthers, and this is my presentation for the gastrointestinal disease clostridial scours found in swine. First, we have the etiology of clostridial scours. It is caused by Clostridium perfringens type C, which is a gram-positive bacteria that produces endospores. It's an anaerobic bacilli bacteria, and it produces exotoxins. Clostridium scours has two forms, which are acute and chronic. The pathogenesis for Clostridial scours is that spores in contaminated feed are ingested by the sows. The sows then shed the organisms in their feces, and then piglets eat the feces and the organisms, and then they are infected themselves. Clinical signs for the acute cases is that it happens soon after the piglets are born, usually within 2 days of them being born. They have bloody diarrhea. They get intestinal lesions, which can be seen in postmortem exams. An intestinal lesion is a blackening of the abdominal skin. Necrosis and hemorrhage of the small intestine mucosa are due to the exotoxin. Unfortunately, piglets rarely respond to treatment when they have the acute case, and mortality can reach up to 30 to 70% within 24 hours of birth. This is a picture that I found of intestinal lesions. You can clearly see that there are parts of the intestines that are darker and could be, say, blackened. Clinical signs for the chronic form of Clostridial scours is it usually happens from days 10 to 14 of age and then goes through weaning. It's less common than the acute case, but it's also less deadly. They will have diarrhea, but it won't be bloody as in with the acute cases. They don't get intestinal lesions, but they do have poor growth rates. Treatments. For the acute cases, there aren't any treatments. For the chronic cases, you can give them antibiotics, which is usually penicillin. It can be given orally or in an intramuscular injection. The antitoxin can be given orally or parenterally within 2 hours of birth. Prevention. The biggest thing is to keep your facility clean. Dirty conditions only add to the occurrence of bacterial growth. Antibiotics. You can give antibiotics to sows in their feed before farrowing and continue giving it to them through lactation. You can also give sows the bacterium or toxoid. This is given 5 to 6 weeks before farrowing, and then it's given again 2 to 3 weeks before farrowing. And then it is also suggested that you give a booster a few weeks before any other subsequent farrowings. This is a picture of the Clostridial bacterium toxoid vaccine. These are sources. These are websites that I got all my information at. If you have any other questions or if you would like to learn more about them, then these are the websites that you should go to.